Hi everyone, welcome back to my YouTube channel. Today we are going to talk about necrosis. So let's start the topic with introduction. Necrosis is a form of cell death that occurs due to severe and irreversible cellular injury. Unlike apoptosis, which is a programmed and often clean method of cell death, necrosis is chaotic, leading to inflammation and significant tissue disruption. Now let's talk about definition of necrosis. Necrosis is defined as a premature death of cells and living tissue resulting from acute cellular insults such as hypoxia, toxins, inflammation, or trauma. This uncontrolled process leads to the breakdown of plasma membrane, leakage of cellular contents, and subsequent inflammation. Its abrupt nature distinguishes it from apoptosis, where cellular components are neatly packed and removed with minimal inflammatory response. Now let's talk about key characteristics of necrosis. Key characteristics of necrosis include irreversible injury as the damage exceeds the cell repair capability in necrosis. The second key characteristic is loss of membrane integrity that leads to cellular content spillage into interstitial space, thus provoking a local inflammatory response. The third characteristic is inflammatory response as the necrotic area attracts immune cells which can further amplify tissue damage. Now let's talk about etiology of necrosis. The process of necrosis takes roots from events that cause an acute insult to the cells, overwhelming their ability to maintain homeostasis. Underlying etiologies for necrosis include ischemia, that is reduced blood flow that causes oxygen deprivation, and organs like heart, kidney, and intestines are particularly susceptible to this kind of necrosis. Second etiology of necrosis is chemical damage, as toxins, corrosive substances, or high concentrations of endogenous enzymes can destabilize the cellular membrane and organelles and thus may lead to the necrosis. Third etiology is physical trauma, as severe mechanical injuries or burn can cause necrotic changes in tissues. And fourth etiology is infections, as pathogens may produce cytotoxins or trigger an immune response that inadvertently harms host cells. So these are the main four etiologies for necrosis. Now we will move towards the pathogenesis of necrosis. At the cellular level, the initiation of necrosis involves cascade of events like energy depletion that lead to dysfunction in ionic pump resulting in cellular swelling, that is also called as hydrophobic regeneration, and eventual rupture of plasma membrane. Mitochondrial damage and the formation of reactive oxygen species or ROS further exacerbate the injury, tipping the cell into an irreversible state of necrosis. Now let's talk about morphological patterns of necrosis. Necrosis can be classified into several types which are identified by their distinct morphological patterns and clinical scenarios. These types are coagulative necrosis, liqueficative necrosis, caseous necrosis, fat necrosis, and fibrinoid necrosis. Now talking about the first one, that is the coagulative necrosis. This is the morphological pattern of necrosis. In this, the mechanism is that it typically results from ischemia in solid organs like heart and kidney. Morphology of this includes the affected tissue exhibits a firm texture with a preserved basic outline through cellular details or lost. Talking about clinical elements, it is common in infarcts where protein denaturation maintains structural integrity temporarily. Now moving towards the next morphological pattern of necrosis, that is liqueficative necrosis. Mechanism often occurs in the brain due to ischemic strokes or in abscesses where neutrophil enzyme digest tissue. Morphology in this, the tissue turns into viscous liquid mass and enzymatic digestion dissolves cellular structure. Clinical elements frequently seen in cerebral infarction and certain bacterial infection. Now moving towards the next morphological pattern, that is caseous necrosis. Mechanism commonly associated with granulomatous diseases such as tuberculosis. Morphology: the affected area appears cheese-like with a granular amorphous appearance. Clinical relevance: it is recognized in chronic inflammatory processes and help in diagnosis infection like TB. Next morphological pattern is fat necrosis. Mechanism: it is often seen in acute pancreatitis or trauma to adipose tissues, where lipase break down fat cells. Morphology. It is characterized by chalky white deposits due to saponification of fatty acids with calcium. Clinical relevance. It helps in assessment of pancreatic injury or blunt trauma affecting fatty tissues. Next pattern is fibrinoid necrosis mechanism. Involve immune complexes deposition in the walls of blood vessels leading to direct injury. Morphology exhibits a bright pink fibrin-like material within the vessel wall indicating vascular damage. Clinical relevance. It is often seen in conditions like vasculitis and malignant hypertension. Now let's talk about cellular features of necrosis. On a microscopic level, necrotic tissue displays several key features that distinguish it from living or apoptotic cells. That includes nuclear changes, there may be pycnosis, that is early nuclear condensation, then karyoregesis, that is fragmentation of nucleus, then karyolysis, that is dissolution of nuclear structure, and it also shows cytoplasmic changes. There are loss of normal organelle structures and swelling, disruption of mitochondrial function leading to increased permeability, and there is also membrane disruption associated with necrosis, that is rupture of plasma membrane causing leakage of intracellular enzyme within the, which in turn indicate an inflammatory reaction. Now let's talk about histological features of necrosis. Histological examination reveals diffuse eosinophilia, that is increased pink staining on hematoxylin and eosin stain, and the presence of inflammatory cells surrounding the necrotic zone. These changes are pivotal in both confirming the diagnosis and understanding the subsequent tissue response. Now let's talk about clinical consideration of necrosis. Interventions targeting necrosis focus on preventing or minimizing the initial injury and managing its consequences. First is reperfusion therapies, that is timely restoration of blood flow in ischemic tissue that can reduce extent of necrotic damage. Though reperfusion itself carries risk of additional injury, that is called as reperfusion injury. Second clinical consideration is anti-inflammatory strategies, as modulating the inflammatory response may prevent secondary damage and improve healing. Third consideration is surgical debridement. In cases of extensive necrosis, especially in infected or compromised tissue, surgical removal of the necrotic tissue is essential. Next is prognosis. The degree and type of necrosis have prognostic implications. For instance, widespread coagulative necrosis in myocardial function often lead to poor outcomes due to loss of contractile functions. And these therapeutic strategies are tailored not only to extent of the tissue damage but also the underlying cause, highlighting the need for early and accurate diagnosis. Now let's talk about conclusion of this lecture video. Necrosis represents a critical response to severe cellular injury marked by uncontrollable cellular breakdowns, inflammation, and significant tissue disruption. Its various morphological patterns, coagulative, liqueficative, caseous, fat, and fibrinoid, provide valuable diagnosis clues that guide clinical decision making. While necrosis itself is a deleterious process, understanding its pathogenesis and morphological features allow clinicians and pathologists to better manage and treat the underlying conditions. And continued research into the mechanism of necrosis promises to enhance therapeutic approaches and improve patient outcomes. And this was all about necrosis. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.